This
Okay.
conference will now be recorded.
Chaturmukha Samarambham Vagbhadacharya Madhyamam Asmadacharya Paryandam Vande Guru Parambaram Ragadirogan Satatanushaktan Asheshakaya Prasrutan Asheshan Aulsukyamoha Aradidan Jakhana Yopurva Vaidyaya Namostu Tasmai. Okay, we will start.
I will read out the first question. The question is, if Utkleshan Snehapan works by bypassing Jataragni, then how does Vicharna Snehapan actual works? Because or Sneha given along with Ahar will result in Ajirna without the action of Jataragni. Then shall we give Vicharna Sneha for Utkleshan purpose?
Yes. I hope the question is clear to everyone. Actually, the sneha which is given for Utkleshana is in Achapana form. Of course, some highly exceptional cases are there, but the rule is to give it as Achapana. And that particular way of usage of Snehana or Snehapana is so tricky. We have explained it in our session in Pune. And if required, I think Dr. Nilesh can share those slides to the members of the group later. I do not know whether you have that slides with you. We can share it because I think there may be many members who have not participated in our session in Pune. So generally it is given in Achapana form only. And Vicharana Sneha generally having some association with something else like Ahara, and it is not ideal for Utkleshana Snehapana. So the question, Vicharana Sneha, how does it work if it is given along with Ahara, which obviously is going to result in Ajirna as it is not acted upon by Jadaragni. That is true. While we are giving Vicharana Sneha along with the Anna Anubandha, Ahara Anubandha, and plan for Utkleshana, it may end up in Ajirna. So ideally, this Vicharana Snehapana is not the option for Utkleshana Snehapana. Then there can be more than one sub questions along with this. Whether the Ajirna cost in the Amashaya and the Anubandha of Ama along with it, which is forming in the Amashaya, can it be a tool for inducing Utkleshana? That is the question, or that is one possible question. Whether that also is a tool for the therapeutic purpose of inducing Utkleshana. That is one question. The answer is yes. It also can cause Utkleshana in the system. Then what is the difference between Ajirna causing sort of Utkleshana in the system and inducing Utkleshana by Shodhananga Snehapana? The difference is the former one, that means the Ajirna induced Utkleshana is unintentional and uncontrolled. There is no option to take a strong control over the developments in the system to the Vaidya. And any condition in which that sort of a Utkleshana is set in the body, obviously, as you all may be knowing, the first option for the Vaidya is to throw it out by proper Shodhana, preferably Vamana. We will find it in Matrashidiyam, we've already described it. That Sadhyam, Amam, Turidam, Ullikhed. So Vamanam is advised. Then in Jvara Chikitsa also we will find Tatra Ulkrishte, Samutklishte. Then also Vamanam, Vamanarhasya, Shastam. So these things we find, but there we are not waiting for something else to happen. We are not waiting for the Amam or the Ulklesham which is set in to take its course further forward. But in the first instance itself, we are intervening with a Shodhana Kriya. So that is the difference. Whereas in a proper Utkleshana Snehapana, it is done under a highly structured manner where the intentions are very clear and the entire situation is supposed to be under the control of the Vaidya. So that is the difference. I hope the answer is clear.
Yes, thank you, sir. I will read out the second question.
Okay.
I have also shared the question bank and sir's PPT or slide on the group, WhatsApp group, for reference if anybody wants. So you can go through it meanwhile. I will read out the second question.
Okay.
Yeah. Can we use Sukumar Ghrita as Shodhanartha? And the second question, sub question is, how does Saratva and Rechen works?
Okay. We will take the first question to answer first. That means, can we use Sukumara Krita as a Shodhana Purva Krita or Snehapana Krita? As you may be knowing, all of you may be knowing that Sukumara Kritam is given in the Vriddhi Chikitsa Ashtanga Hridayam. And interestingly, it is a very special type of preparation. Obviously, that could be the reason why there is a question like this. Sukumara Kritam is prepared in a peculiar manner. The original yoga has Gudam in it, Eranda Tailam in it, and Kritam in it. And interestingly, this yogam is prepared in more than one way or multiple ways, like as Sukumara Rasayanam, which is the classical yoga, then Sukumara Kritam, and the third one is Sukumara Eranda. Even in some Vaidyas make even Sukumara Tailam. So as I mentioned earlier, the original yoga has Gudam in it, Eranda Tailam in it, and Kritam in it, and also a high amount of Saindhava. So when you take this Sukumara Yogam in its original form, which is better known as Sukumara Rasayanam, it is not ideal for Utkleshana Snehapana. Meantime, the one prepared with the Krita alone, that is one way of making it, in which the Eranda Tailam will not be added. Even some pharmacies will not add the Gudam in it. So that way of preparation with the Krita alone may be used for Utkleshana. the high amount of Saindhavam is also a matter which is to be considered, because when we do Snehapanam with this, in 2-3 days time itself, sometimes even before that, there is every chance of getting excessive bowel evacuations, making it very difficult to move forward with the procedure. So that is the story of Sukumara Kritam. So when the question is about Sukumara Kritam, the answer is yes, you can use it for Shodhanartham. But if it is just about Sukumara Yogam, the ideal one is Avaleham, then the answer is no, it cannot be, or it may not be used for Utkleshana Snehapanam. And the second part of the question was, how do Saratva and Rejana work? In the classics of the Brihatrayi period, one may not find much difference in the usage of these words. Many times they can be used, they can be seen used interchangeably. Rejanam, Saranam, or Sramsanam, Anulomanam, Bhedanam, all these things can be used, can be seen used interchangeably. But maybe with the Sharngadara's explanation in his Samhita later, I think some sort of a differentiation came into existence between these words. And they started explaining it differently. Sramsanam, Rejanam, Bhedanam, all these words. Of course, this using these words interchangeably need not be the correct way of doing things, no doubt, because the gunas involved in different karmas obviously shall be different. Say, for example, Saraguna will be the leading principle in the act of Sarana, whereas in maybe in Rejana, there may be some Tikshna Guna in the fore. I'm giving it as an example only. But if you see the texts like Sushruta Samhita, maybe in the 46th chapter of his Sutrasthanam, Sushruta equates Sarana with Anulomana, Sarvo Anulomana. So there is no difference according to their perspective. And this Anulomanam is, as per the Sharngadara's explanation, that Krutva Pagam Malanam Yad Bhitva Bandham Adhonayed Tacha Anulomanam Jneyam Yatha Prokta Haritaki. So that is one way of understanding what an Anulomana Dravya is. And Saram is same, if Sushruta's words are taken for granted. Sarva Anulomanaha. Whereas the other explanations are also different. In coming to the Rechana, I think Vipakvam Yat Apakvam Va Maladi Dravadam Naedu Rejayatyapi Tatnyayam Rechanam. And the example given is Truvrat. So the way in which Truvrat is acting and Haritagi is acting, that is the question. There are many other principles or other influences in deciding it, because Truvrat to a greater extent is used as a Virechana Dravya, no doubt. But Abhaya or Haritaki is used for many other purposes, as we all know. And that Krutva Pagam Malanam, so as an Anulomana Dravya, having Virechana property, when we use Haritagi, our intention is to bring many other things, like especially the Pajana property of the Dravya. which may not be a consideration while we are doing just Rechana. Because ideally, I mean, a Rechana Dravya is used only after proper preparation of the dosha by some other mode. And then just for the act of expulsion, the Rechana Dravya is used, like Truvrat. Whereas a medicine which is Anulomana, which is otherwise Sara, is also used for the Pajana property. So that is why we have many yogas which contain Haritagi in our day-to-day practice when compared with the yogas containing Truvrat. So I do not know whether I gave a very precise answer to the question, but I think, or I believe that I have given some important points which obviously will lead the person who asked the question to come to valid conclusions. Okay.
Yes, sir, definitely. The questions which came that day, written on pieces of paper, we have compiled that and we
Okay,
have made a question bank of that.
that's
Our
great.
genuine purpose is that each and every question should be answered so that our purpose is fulfilled. Okay.
Oh,
So I'll read
okay.
out the next question.
Yes.
Is it possible to prolong duration of Snehapan for 1 or 2 days by giving Viram for 1 day because of circumstances like heavy rainfall or Durdin?
Fine. If that second half of the question is the point which gives thrust to the first part, that means because of circumstances like heavy rainfall or Durdina. So that means we have already into the process. We started as Urklesna Snehapana. I think I presume that it is all about Utklesna Snehapana, because as far as the other two are concerned, it is not a big concern. So in Utklesna Snehapana, we already start the procedure, and in between the Vaidya come across some situation where he is reluctant to continue with the procedure. So is it ideal to give 1 or 2 days of break in between and complete the procedure later? Actually, it is not the way of doing it, I think. We have to give some extra or additional care to the patients in that given situation to avoid or nullify the effects of the Durdina, and should continue the Snehapana uninterrupted. That is what we have to do in such a situation, because the procedure of Utklesna Snehapanam is so delicate. Once the body and the procedure, they come to a sort of understanding between them, some sort of a truce. It is becoming Satmya, then this Utkleshana karma will not be happening. And another thing is, once we have initiated the process of Utkleshana Snehapana, we are inducing some sort of a highly threatening therapeutic situation within the system. We are inducing a lot of ama, which can be dangerous even to the patient. So once the process is initiated, as we see in the case of some other explanations in the textbook, Kritva Shidoshna Vrishtinam Pratikaram Yathayadham Prayojayet Kriyam Praptam Kriya Kalam Nahabaye. Taking the same idea as a lead, I think we should continue with the Snehapanam, taking enough precautions to come over the restrictions built in by the Durdina, influence of Durdina, or whatever it is. Okay, so that is the answer.
Yes, very rightly said, sir. I will read out the next question.
Okay.
In Shirodhara, in some patients, we do karma for 20 to 30 minutes every day. And in some patients, we gradually increase the time by 5 minutes, like 25, 35, 45 minutes. And then again, decrease it or reduce the time 45, 40, 35, 30, like that. The question is, when should we keep it stable every day, and when should we change it, or Vruddhi and Rahaskram, in which avastha and in which patients?
Okay. As I mentioned in the one of the previous questions, I may not be giving a answer like a multiple choice questions, this one or that one, but I will give you a fairly good idea about the entire process. Then I think something like as Krishna advises Arjuna, Edavadeva Vijnanam Yathechasi Tadha Guru. The person who asked the question will be able to come to a logical conclusion. So here the point is, what makes or what is going to be the decisive factor in making this sort of decisions, like I'm going to continue with the same time slot, or I'm going to increase, or I'm going to increase and then decrease. I think there are different styles of practicing Shirodhara, and it is very difficult to conclude which is right and which is wrong. But however, there should be some rules which regulates these practices, no doubt about it. There should be some rules which regulate these practices. See, Shirodhara is a Murdha Taila Prayoga. Everyone will admit it. And its intention is to bring Snehana to the Jatrurtva. That one also will be understood clearly. And the next point, I think we should listen carefully. In the same way as we are doing a Snehapana, Murdha Taila also can have 3 types in it. That means Shamana, Brahmana, and Utkleshana. We have Shamana Snehapana, Brahmana Snehapana, and Utkleshana Snehapana. In the same way, you can have Shamana Murdha Taila, Brahmana Murdha Taila, and Utkleshana Murdha Taila. This should be the leading idea in designing and executing the right procedure in the right way. The time of doing Tailadhara, that means whether it is in the morning of the day or in the evening, then duration of the procedure as mentioned in the question, 20-30 minutes or 45 minutes, like that. Then temperature of the Taila used, then the way in which it is done as mentioned in the question. All these are going to influence the outcome. For example, Tailadhara done in the early morning can be a bit Utkleshana in nature. I repeat, Tailadhara done in the morning hours, early morning hours, can be a little bit Utkleshana in nature, whereas in the evening it will be more of a Shamana type. Dhara with some temperature maintained all throughout the procedure can cause Ulkleshana. Whereas one patrapaga done in the beginning and no further warming of the oil in between can be more of a Shamana or Brahmana type. Similarly, dhara done for a fixed time, as mentioned in the question, will be more like a Brahmana or Shamana, whereas the one in which the time is increased steadily to peak at the end, not the Vriddhi Hrasa Krama, but Vriddhi Krama only, that can be Ulkleshana more. And the pattern of increasing first, reaching the peak, then decreasing will be more Brahmana, as it never disturbs the system. It is very slowly induced into the system and very slowly withdrawn from the system. So while we look at these possibilities of doing Tailadhara, in real practice, we should understand that multiple combination of all these variables are taken into consideration by the Vaidya, and obviously that shall be the best option to choose the right way of doing Shirodhara. Okay, is it clear?
Yes, sir, very much.
Sir,
I think
please, can I ask one more question, sir?
yes,
Oh.
yes, definitely, sir.
Sir, apart from all the criteria which are explained now, is the status of Agni can also be considered in having a Utkleshanartha Shirodhara and Shamana Shirodhara?
Definitely. But the question is completed. Ashwin, question is over?
Yes, sir. I asked the question, sir.
It is complete, no? Question is complete.
Yes. Yes.
Okay. You see, Agni is very, very critical and very decisive as far as Shirodhara is concerned. And the interesting thing is that it is not in defining or deciding whether the Tailadhara should bring Utkleshana or Shamana, but in the very basic question that whether the candidate should be opted for Shirodhara or not. If the Agni is Manda, he is not a right candidate at all for doing Tailadhara. In a case of Agni Mandya, ideally you should not opt for Tailadhara.
That is, sir, instead of, even the individual who is having a good Agni, which is the basic criteria for going for Shirodhara, in the person who is having a good Agni also, in the early morning, in the Hestane, Jirana, Evanne, in that status, if the Shirodhara is done, whether it can be done or not is the question, sir.
The cause of the Agni Mandya should be looked into very properly. Because if it is because of the presence of ama in the koshta or general weakness of the patient, whether it is associated with Agni Mandya alone or along with many factors which is going to decide the balam of the patient, all these things are to be taken into consideration. If it is just because of ama and you feel that okay, this ama from the koshta is spreading all to the Jatrurdhva and it should be controlled at any cost, you can opt for some other procedures.
My question is, I think I am not clear with my question, sir. So my question is, the individual is having good Agni and he is a fit candidate for Shirodhara.
Yes.
In that individual, in the early morning, the individual is having a good Agni throughout in general. Yes. For him, when we opted for Shirodhara, if his Agni status is just that he has completed the Jirana of the previous food and he has not got the good appetite, in that Hestane Jirana Evanne status, whether he can, if the Shirodhara is done, Whether
Yes.
first my question is whether the Shirodhara can be done in that state or in any condition the individual who is undergoing Shirodhara, whether the Agni should be very much already it has come up, or in the status of Hestane Jirna Yavanne, if that in that status the Shirodhara done, he will get more Utklesha. Is that possible, or how it can be understood, sir?
Yes. One point we should keep in our mind. Of course, what Ashwin was asking, that means if this in a properly prepared patient with a proper Agni Dipti, if Utkleshna, if a Sneha Dhara, Taila Dhara is done in the early morning hours, which corresponds to a status of Hastane Jirna Evanne, will it be ideal for bringing Utkleshna? That is one part of the question. Am I right?
Yes, sir.
Definitely yes. But one point what we have to keep in our minds is that this Utkleshana will be by and large confined to the Jatrurtva. You should not expect a Sarvanga Utkleshana with this Tailadhara alone. That is another point. And what was the second half of the question? Or have I answered the question completely now?
You have answered to an extent, sir. But my question is, in that Hestane Jirna Evanne status, whether the Shirodhara can be done or it cannot be done, sir?
It can be done. It can be done. If your intention is to bring Utkleshana. If your intention
if the Agni has come up, and if we are going for Utkleshanartha, and sometimes it can become a Mithya Yoga as well, as no, sir.
But I think here, unlike the Sneha, which is having a direct encounter with the Agni, as in the case of Snehapana, we have some advantages here. Here we will be making use of the Kabha Kala more.
Yes.
So if and the Kabha Kala is not covered, is it clear?
Yes, I got it, sir.
Yes, if the Kabha Kala is not covered, you can expect this Utklesha. But if that time is already exceeded, then you cannot expect the same. So there is a slight difference. It is not the exactly similar mechanism as it is done in the case of Snehapanam. In the Snehapanam, there is a direct encounter between the Sneha and the Agni, which is not happening in the case of Tailadhara, which is quite obvious. So that advantage is there actually. Okay.
Thank you, sir.
If you have more questions, definitely I will be happy to look into it. So please look into the answer which we have given and come up with more questions if you have. I shall try to. Okay, Ashwin.
Yes, sir.
Yes, sir. We will move on to the next question.
Yes.
How to know the difference between Shodhana Sneha Kal and Rasayan Kal?
We have another question in between. You missed one in the question bank sent to me. I think there is another question.
That question is answered in our question and answer session, sir.
Oh,
in actual.
Fine. Okay. This question, how to know the difference between Shodhana Sneha Kala and Rasayana Kala? Actually, that question is not very clear to my understanding. That means if we have that person who asked the question here in our meeting, then it will be good if he explain this. Rasayana Kala means? That is the point which
sir,
I could not.
Yes, Rasayan Kal. Yes, actually we don't have the name who asked this question, but if he is here, he may explain us.
Yeah, that will be good because
they have asked 3 questions.
Yeah,
the same person has asked 3 questions.
The other 2 questions are I saw it's good also, but in this case I could not make out what is understanding or what he is trying to explain.
Yes.
The Rasayana Kala in this context.
Yeah, yes, sir. My interpretation about this question is the person wants to ask, as Shodhana Snehapan is given in the morning and Rasayan Kalpa or Rasayan Aushadha are also given in the same kala, in the morning or the Pratah Kal. So, how to differentiate between those kalas? How to differentiate?
Yeah, actually, when a rasayana is done properly, here in Shodhana Snehapana, the time specificity is so precise. Hestane jirna evane. It is very important also. Whereas in rasayana kala, if it is about what Vaidya Nilesh was explaining, the kalam is a little bit different, because with the rasayana prayoga, we are going to do some sort of a samskara of the sharira. It is not just about giving a small quantity of ghrida in a particular kala, nothing like that. In the Rasayana Prakarana, where we go, I think if you look at one of the major Rasayanas, I mean the Rasayana called Brahma Rasayana in Ashtanga Hridayam. There is one yoga called Brahma Rasayana. There we find the general rule for giving the Rasayana Prayoga. We find Ya Nobarundhyad Ahara Megam Matrasya Sasmruta. So that is about the Matra. But that Matra gives us some idea about the Kala also. So here what is advised is Ya Nobarundhyad Ahara Megam. So the Matra of Rasayana is like that. It does not prevent the usage of ahara in one kala. So one kala is kept for ahara, and one kala in a practice of two anna kalas, the second kala is exclusively for rasayana. That is the way in which it is advised. So it need not be in the morning alone, or it may not be in the evening alone. One annakalam and one aushadhakalam. That means the rasayana aushadhakalam. In our current practice, where we are splitting the two aharas into 3 or 4, and if we apply the same rule here, you can have one ahara kala or one ahara in ahara kala, and the rest of the ahara kalas should be for the rasayana aushadha. So sometimes you may be having one breakfast and lunch and dinner will be with rasayana, or one dinner, then the breakfast and lunch will be with the rasayana. So there is no specific rasayana kala which can be taken for granted and as applicable for all the type of rasayanas. Only rule is that it is highly subjective, and the rule is one ahara kala should be permitted. Rest everything for rasayana aushadha. Okay.
Yes, sir. We will move on. The next question is Matra Basti or Anuvasan Basti in Garbhini.
Yeah, in that case, I think there are specific textual references, no? That means generally it should not be given up to the completion of the 7th month. And afterwards, definitely it is advised also. So in the 8th month, we find the specific advice for both the vastis. That Shuddhai Purana Shakrataha, we find certain vasti prayoga, and this Anuvasanam also. And afterwards, again we find, okay, they can be given with the Anuvasana or Matravasti, or whichever is convenient. And in 9th month onwards, we find that Snehangi, Navaman, Masat, Prabhati Vasayed. So there also there is good space for practicing Anuvasana or Matravasti. So that is the general rule followed in that case. Up to that, generally it is not advised. So the word generally should be underlined. In a given case, the Vaidya has got all the freedom to do Matravasti or Anuvasanavasti in a Garbhini. So it is not a complete ban on Matravasti or Anuvasanavasti in Garbhini. If the Vaidya has got a logical decision to do Matravasti, it shall be done, no doubt.
Yes, sir. In practice also, generally Matravasti are given in Navama Mas in 9th month, and Niruha Basti or this for Purishodhan Basti, it is given in last week of 8th month.
Yes.
Here also in Pune, we practice the same pattern.
Yes.
Yes.
8th month
So
onwards.
it is,
okay. This can be
yes,
seen.
yes, in the
In
last month, yeah.
yes, yes. In text also we will find the same thing.
Yes.
Ksheerapeya japeyatra saghada anvasanam hitam. That is the first instance where we find the advice of Anuvasana in Garbhini.
Yes. We will move on, sir.
Yes.
How Stambhan occurs after giving Matra Basti in Rakta Pradar?
Yeah, I think again that question is not very crystal clear, but I think how does it work? That could be the message behind the question, I feel. So if that is the case, I think the answer is the correct dravya. The proper dravya is the reason behind it. If it is not just because of the procedure, this pradaram and all related conditions are all under the generally under the control of apana vayu, and apana vaigunya is a critical element in it. So that way matravasti or tailavasti has got a specific role in it, but that stambhanam of the raktasravam, if that is intended or that is to be achieved, I think simply a matravasti with any of the dravya, sneha dravya, need not work, but specific dravya like maybe the kridamandam or whatever, maybe even kshiram or that sort of things are to be opted for. So dravya prabhava is going to be one important factor behind that. Okay.
Yes, sir, definitely. We will move on. The
Yes.
next question is, during Shodhanartha Snehapan, is there need to give Bhakti for Snehapachan?
It should not be. Answer is no. It should not be practiced. In Shodhanartha Snehapana, Abhyandara Ushadhas are not advised. That should not be done. Because the entire story will come upside down in that case. Right.
Yes, sir, definitely. I think I will upload the recordings of our Sneha Tattva Prasad shortly. So those who have not attended or have queries regarding this, they should go through the entire session once again. So many of their queries, doubts, or questions will be cleared after listening to those recordings, I think. Yeah, we will take next question, sir.
Yes.
In some practices, during Shodhanartha Snehapan, medicated ghrita or ghee 250 ml plus Gogrudha 750 ml, 700 ml is given to Rugna. Is it? I think I don't know from, yeah.
I'm really sorry to say that I have not come across such a practice, so I'm not able to comment on it.
Somebody's mic is on.
We'll continue, no?
Yes, sir, we will continue.
Okay.
Shall we take the next question?
Yeah, I have, because this particular question I cannot comment because I have not come across such a practice. 250 ml of medicated krida, siddha krida and 700 ml of go krida, and the way in which it is used is not explained. So I'm not in a position to comment.
Yeah, we will take the next question. I think if the person is listening, they should come up with a very clear question or
Exactly.
the specific references, so that
Exactly.
we can make it clear afterwards. Yeah, the next question is Snehapan for Shodhana nothing but Vidhi Viruddha or Avastha Viruddha?
Yeah, technically speaking, it is true. It is true. What we are doing in Shodhana Snehapana or Udkleshna Snehapana is a sort of Vidhi Viruddha or Avastha Viruddha intervention. But the difference is, see, generally the Vidhi Viruddha or any top type of Viruddha, the word Viruddha in that particular usage shows that it is Viruddha to the Dhatu, Viruddha to the Srotas, Viruddha to the Sharira. So generally this one is also Viruddha, but the difference is this is an intended usage and it is a controlled usage. So that induction of Viruddha in this particular stage is having well-defined purposes, and the Vaidya is in full control of the entire process. Whereas in the Vidhi Viruddha or Avastha Viruddha, Ahara Seva or that practices, the person who is using this or the person who is suffering the outcomes of these sort of practices may not be even knowing that this is going on, and may not have any control over the entire process. Here it is highly structured and highly controlled intervention. So technically there is a stage of Vidhi Viruddha or Avastha Viruddha developments, but that is not allowed to take its natural turn of developing into various vyadhis, but it is taken in and thrown out with proper shodhana. Okay.
Yes, sir. We will move on. During Shodhanartha Snehapan, Kalpa like Shankhavati, Sutshekhar are used. Are they effective? Many times this leads to Vyadhi Shaman or the presenting Lakshanas are reduced. I think the two questions before to this, the same query came. If
Yes.
sir wants to comment on this, or we can move on, sir.
Yeah, we can move on because this is not a proper practice. It should not be done.
Yeah, I will read out the next question. Uh, while administrating Sneha Kalpana, what should be the Agni Vichar for? Means the question, I think, is not that much clear, or it is
I think that
answered in our main session?
yeah, after that Agni Vichara for two parts. Number one, a diabetic patient depending on allopathic medicine for preparing for Pradhana Karma. Number two, Agni Vichara for a hypertensive patient dependent on allopathic medicine. Can we go for an, I think something like that could be the question.
Yes, yes, sir. Yes.
But it is that way it is important. That way is important because when the patient is on some allopathic medication, especially in these sort of Yapya or Kruchra type of Vyadhis, it is very difficult to make a clear-cut idea about his Agni Sthiti. It need not be these two conditions. There are many other situations like people who are taking regular steroids for managing some autoimmune diseases, who are diagnosed with very common this sort of conditions like rheumatoid arthritis, which are of course defined as autoimmune nature, and taking disease modifying agents or therapeutic agents like methotrexate. These are not uncommon. They come across our daily practice very often, and definitely in such cases extra care is to be done while you are opting for Utkleshana Snehana and Shodhana, because what we see and what the reality is, they may not be matching with each other. So I think it is not ideal. Patient on insulin, patient on anti-diabetic drugs, all these things are very important. And meantime, yeah, these are the two situations, the hypertensive patient and the diabetic patient. But it is not limited to those two. The Vaidya has to do extra homework while going for Shodhana Chikitsa in such patients, no doubt.
Yes, sir. I think the the answer is clear now. We will move on. Why Rukshana is performed in Visham Agni Avastha?
Yeah, that is again a very interesting question, but definitely it is important also. It is very important also. At one point in Snehapana Vidhi, we find this sort of a suggestion. That means Mamsala, Medura, Bhuri Shleshmano, Vishamagneya, Snehochitashe, Snehyas, Tan Purvam, Rukshayet. Tataha Sam Snehya Shodhayed. Evam Sneha Vyapanna Jayade, Alam Malanirayidum, Snehas Gataha. So I think that is the background from which this question has come. All other conditions mentioned here, other than this Vishamagni Avastha, they are having some sort of a Sandarpana, they are all Sandarpana Anugamya Avasthas. Mamsala, Medura, Bhuri Shleshmano, then Snehochita, all these things are like that. And 2 points are highlighted here as the advantage. Number one is Sneha Vyapad na Jayate. And the second one is Sneha Asatmya Karana. Snehascha Asatmyadam Gataha Alam Malan Irayitum. So in Vishamagni, Vishamagni is generally a technical term. It is a technical term. Where it is mentioned as a Vada predominant Agni. So here it is a Vada predominant condition. So what is the need where all other are Shleshma predominant conditions? The aim of Rukshana here, first thing what we have to consider here is this Vishamagni usage here need not be in the exact technical meaning of the word. That means a Vada predominant Agni, but just an unsteady Agni could be the sole meaning of that term. That is one possibility. Number two is the aim of the Rukshana in the entire situation is to stabilize the Agni, reduce that fluctuating elements to the best level possible, and also to confirm the nature of Agni well in advance of starting the Snehapana. It is very important to explain the text properly. And interestingly, if you go through the commentary of Hemadri, while commenting on this Rukshana, he is very specific to comment that Rukshanam hi Pajanameva, or otherwise Pajanam hi Rukshanameva. So here, according to Hemadri's observation, the Rukshanam means any type of Rukshanam, and here Pajanam should be the best option. So in that case, I think the Rukshana Kriya is nothing but Pajana Kriya, and it is intended to stabilize the Agni and to get a very clear basic idea about the status of the Agni. Having said this, I should admit honestly that why such a comment came as an odd man out nature in this shloka is still a matter of controversy, because all the other conditions added on are Shleshma Pradhana, only this Vishamagnika is Vada Pradhana. So that's a very good question which we will have to explore based on the clinical experience as well. If somebody is having any specific experience to comment on this question, I think it's most welcome.
Yes, sir, definitely. We can have. Yes,
Yes,
Ashwin, sir.
somebody is speaking.
Sir, this Vishamatva, if it is because of Kaphavataja condition, and that could be a reason why the Vishama Agni is also considered here.
Yes, that
it is
true.
Not Kapapitta, but Kaphavataja condition, that type of in a condition where Kaphavataja Vishamatva, Agni is getting the Vishamatva because of the Kaphavataja condition, where we need to go for a kind of Rukshana before getting the going for the Snehapana.
That is true. That is true. That is why I mentioned that this need not be a highly technical usage of the Kevala Vadiga Agni, but it can be something like we can find that sort of usages where the technical term is used in a very non-specific manner in the textbook. So that is one possibility, no doubt. Thank you, Ashwin, for that comment. But anyway, I think that statement worth, I think, exploring more.
Yes, sir, definitely. Now we will take the last question, as it is already 2-3 minutes past 9, and then we can conclude our session.
We will complete it.
Yeah. So the question is, if on 7th day we don't get Sneha Siddhi Lakshana, what is to be done? Shall we stop as per Grantha, or we can go on for 9, 10, 8, 9, 10 day like that?
Yeah, that is again an important question, but Vakbhada tries to address this challenge or this particular issue in a very practical manner, because the entire purpose of doing this Snehapanam, Utkleshna Snehapanam or Shodhananga Snehapanam is to induce full range of Utkleshanam in the system. And as we mentioned earlier multiple times, that this is an assault, as so in the earlier question, this is even a avastha viruddha or vidhi viruddha prayoga. So the system is becoming challenged. Even at one point, what is viruddha is defined as Utklishya doshanna hared dravyam yattat samasatah viruddham tat vidhadunam. So we are inducing a viruddha avastha, and that Utklesha avastha should never become satmya to the system. That is why we have this 7 days of time frame, because generally everywhere we can find that to any assault the system comes to some sort of an understanding with the assault in first 7 days. First 7 days it will be fighting, it will be resisting, it will be trying to throw away, it will be trying to cancel off. But after 7 days, slowly it gets accustomed, it gets acclimatized with the assault, and it practices to live with the assault. That we can find in many ways, even in some other situations. Saptahena bhalalabhe kriyamanyam prayoje. So after 7 days, okay, it is not going to make any specific effect. So that is why here also we find that krure saptadinam pibe, that's the maximum given period is 7. But at the same time, the second line, according to Vakbhada Sashtanga Hridaya, we will find that is very interesting observation. Samyak snigdho adhava yavad. So it is not a matter of 3 days, 5 days or 7 days, but it is more about samyak snigdho adhava yavad, up to attaining samyak snigdha lakshana. Because after doing snehapana for 7 days and not achieving samyak snigdha lakshana and leaving the patient as such with an improper samyak snigdha lakshana is going to be more dangerous than extending the snehapana for 1 or 2 more days with a proper assessment of the Agni and Koshta. So definitely it is wise to go ahead with the procedure for the 8th or 9th day, the shortest possible, and achieve the proper samyak snigdha lakshana, and not to leave the case as such without samyak snigdha lakshana. It will be interesting to go through the commentary of maybe Arunadatta as well as Hemadri in this regard. Satmibhudah, that is a risk. Satmibhudo hi kurude na malanam udiranam adiyogena va vyadhin yatham bhogho adiyojanad. यदि तु सप्ताहेनापि स्निग्धलक्षणं न उत्पद्यते तदा दिनम् एकं विश्रम्य पुनः स्नेहो योज्यः इति सद्वैद्याः. That is opinion of Arunadatta. Break for 1 day and continue. But even in my clinical experience and observation, even that need not be given, need not break. A break is going to be dangerous many times. Try to limit the usage to the 7 days, plan everything accordingly. But even in the worst of the situation, in an untoward development, if you miss it, continue for the 8th or 9th day and achieve the samyak snigdha lakshana as early as possible. That is what we have to practice. Okay.
Sir, one small query in that.
Yes.
Does if samyak snigdha lakshana are not achieved in 7 days, does the snehapan or the kriya become satmya, so that we are not getting the samyak snigdha lakshana? Is it one of the reason?
Yes, that is a risk. After 7 days, even to the highest degree of an intervention, body develops some sort of a satmya. But here it is not like an ahita seva alone, like any other things. Say for example, if you are taking some sort of a asatmya bhojana, after 7 days it slowly becomes satmya. It is not like that here. We have induced a very dangerous situation within the system, and it is almost nearing the completion. of what we plan to, but it is not complete. So two things. Number one, in maybe 1 or 2 days time, we may be able to achieve what we targeted for. But at the same time, there is a challenge that the entire process may collapse because the body may stop responding to the Snehapana in the way we plan to. So between these two, our option, the Vaidya's option, is to select the best. And that best obviously is to go ahead with the Snehapana and achieve the Samyak Snigdha Lakshana as early as possible, because there is some sort of a miscalculation already, because initially our intention was not to go beyond 7 days, to achieve the Samyak Snigdha Lakshana as early as possible, but that did not happen. So you are not supposed to break it in between. Go ahead and achieve the Samyak Snigdha Lakshana as early as possible. Otherwise, I think the Sneha Vyapat will be more dangerous than the risk of this Sneha becoming Satmya. That is why I suggest that, okay, it should be continued. Okay.
Yes, sir, definitely.
Yes.
I think we have tried to cover
In just
maximum.
1 minute, Nikesh.
Yes.
In Arunadatta commentary, if we go through, त्रहेण सम्यक् स्निग्धलक्षणं न स्यात् तदा चतुष्पञ्जरात्रमपि स्नेहं पिबेत् मध्यकोष्ठस्तु षड्रात्रमपि पिबेदित्याह सम्यक् स्निग्धोदवा यावदित्यादि अथवा न एष नियमः सम्यक् स्निग्धलक्षणोत्पत्तिरेव नियमः. That is very, very important. That is the point which is to be underlined. Samyak snigdha lakshanolpattihi eva niyamaha. Ataha saptahadapi urdhvam achasnehaha peyaha yavad snigdha lakshanam syad. And after achieving this samyak snigdha lakshana, if you continue snehapana, definitely it will become satmya and it will not serve the purpose of ulkleshana. Okay.
Yes, sir, definitely.
Sir.
Yeah.
What is the reason that minimum of 3 days are mentioned, no, sir? So, what is the reason? Is there any specific reason for that?
I think this snehana in Mrudu Koshta, I think you might have already taken into account of the explanation. That means this 357 is based on not on the Agni Bala, but on the status of the Koshta. Isn't it? We were thinking, or we were discussing everything based on the status of the Agni. But at this point, the entire explanation is shifting. Trehamacham mridau koshte krure saptadinam pived. So our emphasis is shifting from Agni to Koshta. So because in the act of this Snehapana, one feature is this Adhastad Sneha Darshana. So there is every possibility of misunderstanding this Mrudu Koshtajanya Adhasta Sneha Darshanam as Samyak Snigdha Lakshanam. So that should not happen. So in Mrudu Koshta, it is ideal that, okay, as early as possible, as quickly as possible, the avastha should be achieved. So that could be the reason, because here the narrative switches over from the Agni to the status of the Koshta. That is one point which we have to be very serious about. Okay.
Yes, in the case of not exceeding, try to make it within 7 days or 7 days. After 7 days, it gets the Satmyatva.
Yes.
Like that, is there any possibility that the Sneha Snigdha Lakshana can also be achieved even before the 3rd day sometimes?
It can, no doubt. And as we mentioned earlier, the Satmya Bhavam need not happen after the 7th day alone. Suppose in a case, the 4th day itself, the Samyak Snigdha Lakshana happens. If you go further on the 5th day or the 6th day, that is also a cause of Sneha Satmya. That should not happen. So that need not be after 7 days. If there is Sneha Samyak Snigdha Lakshana on the 2nd day, then the 3rd day of Snehapana is going to make the Sneha Satmya to the Sharira.
Yes. Sometimes that means we also there is possibility that the Samyak Snigdha Lakshana can be achieved on the 2nd day itself.
Yes. Theoretically, whether it is happening in everyday practice, because many things changed. That is a problem.
True, sir. And this anti-gastritis medicines, people who are on now for many reasons now, I think that is bringing a lot of hurdles in assessing the proper conditions many a times.
True. Miscalculations. We will be putting ourselves in trouble. We will not understand what is going on.
Yes. Mm-hmm.
I do not know whether the answers were satisfactory. Of course, there may be many other answers for all these questions, but I have tried to explain basically these things on the basis of my experience and what I have been practicing. Of course, more answers on these questions are always welcome.
Yes, sir, definitely. I think such discussions or interactive sessions should go on so that each and every query or question is answered and the concept is crystal clear to everyone.
True.
Yeah. So that we have in today's session, we have tried to cover the questions which were asked. As sir told that we have sir have tried to answer it with his experience and his studies, so that with this I think we will conclude our today's session. It's
Yes.
almost 9:20. So
Sir, one last request, sir. I think we are yet to discuss. You need to tell about Nirama. What exactly is Nirama Avastha, Sama Avastha, and Pakva Avastha of the dosha, sir? What is happening here?
Yeah.
If you explain that, then I think all these things will have much more impact in understanding the real situation.
Fine. I'll do that, Ashwin. Definitely, I'll do that. Let me
Thank you,
try
sir.
to. I already have made one